Well, members of the public will be able to get their COVID-19 boosters and flu shots starting tomorrow across the province. Joining us now live is Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Thanks for joining us here live on CP24. Let's talk about the staging of this, because now we understand that both are available to the general public. Were more prioritized groups allowed to get access to this earlier?
Oh, thanks so much, Phil. Yes, so over the last month, we've been working diligently in our long-term care facilities, our elder care lodges, our retirement homes, and our hospitals to try to provide the vaccines first to those populations, our healthcare workers as well. And now I'm happy to say we, as of Monday, will be able to offer the vaccines to the general public.
And I know anecdotally, just from my experience, my kids, 3, I have friends who have young kids who started going to school and then immediately came right back home with some kind of virus, whether it was COVID or the flu. Are you getting some reaction, people saying that this may have been a bit late? This could have been maybe easier to do just for everybody to get access to this maybe in September?
Well, I'm sorry to hear about your kids, but it's not abnormal for children to get respiratory infections every 3 weeks throughout the winter season. I'm happy to say, though, that influenza activity has not started across Ontario. So now is the perfect time to get vaccinated against influenza before it is actively circulating. And I think we know it takes around 10 to 14 days after the immunization to have your immunity. So these coming weeks are really need Ontarians to come forward to get protected, to have the safest winter holiday season we can, and there's no better way than being protected through immunization. You can get the updated XBB COVID vaccination at the same time at these clinics, so we're actively asking Ontarians to come forward once again to stay protected, both with the influenza vaccine as well as the updated COVID vaccine.
And so how do both of those solutions work? Like how does the influenza vaccine work? How does the COVID vaccine work? What do they do differently in our body?
So those are two different viruses with two different means of infecting us. And the influenza vaccine is more of your typical antigen vaccine, which stimulates antibody production over those 10 to 14 days. And then you have a very good level of protection throughout the winter months for around 6 months. So it gets us through to the spring. And the same with COVID, except it's an mRNA vaccine, which triggers your body to produce the antigen, and then you react against it. So both are safe, effective, and it's very convenient to get them at the same time. On Monday, I was able to book an appointment at my local pharmacist, and I'm getting both at the same time, and looking forward to being protected for the entire winter season.
Okay, that's great. And so people can just go to their local pharmacy, or what are the best locations for people to go?
Yeah, I'm so happy. 3,200 pharmacies have signed up to be partners for immunizing against influenza and COVID throughout the winter. Our public health are running clinics, and I was able to go online and see there's many open spots over the next coming weeks, as well as many primary care providers are especially providing the influenza vaccine in their clinics. So we have plenty of vaccine, we have access, availability, and it's a call to Ontarians. These next 2 weeks are critical to stay protected, to get the maximum benefit of the vaccine. We want all Ontarians to have a safe and healthy winter, and no better means is by getting protected through immunization.
And so just to confirm with immunization, it's been a while since the height of the pandemic, thank goodness. The worst part is behind us. So with both of these vaccines, do they both prevent infection, or is it still they prevent to get the worst outcome if you are indeed infected?
Yeah, I think you're right there, Phil. The benefit of these is they decrease your risk of having to spend some of your winter in an emergency department or in hospital or in the ICU. They decrease your risk of severe outcomes, and we have a potential good match for the influenza vaccine as well, which has a high protection rate against hospitalization, ICU, and quite frankly, death. So please, Ontarians, consider getting protected through immunization. We want to protect each other throughout this winter season and enjoy the holidays as best we can.
All right, Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Thank you very much for that announcement. I appreciate it.
Thank you, Phil.